We have today, congratulations to our colleague at Health Canada, we now have one approved vaccine. But our planning still continues with respect to having potentially both Pfizer and the Moderna vaccine in hand. So one thing I think that we've already shared is that looking at the sort of the logistics, the fact that the Pfizer vaccine obviously is much more challenging in terms of the cold chain requirements, ultra cold chain. The discussions we've had at the SAC table have led to a consensus decision that it doesn't make practical sense to use the Pfizer vaccine in the territories up north. And therefore, their request was that, yes, maybe they'll sit out. They won't sort of expect to receive the Pfizer vaccine, but they would like the Moderna vaccine. So here we go in terms of, I think, good FPD collaboration. If we're expecting around 6 million doses total of the two vaccines in the first quarter of 2021, there was agreement that the territories, in terms of their allocation, will receive exclusively the Moderna vaccine, or maybe other vaccines that are approved, but are obviously not as stringent in terms of logistical requirements like the Pfizer vaccine. And I think, to the credit, the provinces have then agreed, said yes, if we're agreeing to send all of the Moderna vaccine to the territories because of the unique circumstances in the north, then we will sort of reallocate and take a greater share of, quote, the Pfizer vaccine available, so that the Moderna vaccine can be obviously given to the territory. So you can see those are the kind of active discussions we're having. So then we move on to sort of the next part in terms of the Pfizer vaccine and the very stringent requirements and the point of what we call utilization, the 14 sites and so on. I think at a very practical level, and I can't speak for the provinces and territories, there's some very, I think, intense discussion and planning going on. Because even if you look at sort of the allocation, the Pfizer vaccine will not come all at once. It will come in sort of regular shipments. So as you receive your first 1,000 doses, who do you give it to? You look at the four groups. In a given province, you might even make a decision between priority populations. For example, certainly the government of Quebec, for reasons I can fully understand, say they would like to have their first doses delivered in long-term care facilities. I think we can get that. In another province, maybe they would say that, with our planning and factors being considered, we would like to vaccinate our healthcare workers first, who obviously give direct patient care. So those are decisions undertaken at a provincial and territorial level. Then you take it down to a very practical level. Okay, if you're going to vaccinate healthcare workers, well, where do you start? All healthcare workers who deliver healthcare, you might have it be easier, more feasible to do it maybe starting off at a facility in an urban setting. Not to say that healthcare workers who provide healthcare, direct healthcare in a more remote or rural setting are not as important, but in terms of the feasibility, the sequencing, those are all factors that need to be considered. So I think I'll leave it at that. And so getting back to your question in terms of Indigenous peoples and so on, those are part of some of the practical considerations, because the final point I'll make is that it's been a point of discussion at the SAC. What is the difference really in practical terms between a community in the territories up north that is quite south and close to the border with a province that also might have a community that's in the northern part of their jurisdiction? It's sort of a political jurisdictional border, but at the end of the day, those two communities, in terms of the geographical reality of what they're dealing with, is the same.